everybody, and I have with me Claire Harrison, and I'm delighted to welcome you, Claire. You know, we're coming up to a really busy time of travelling and change, and I thought it might be useful for our global community as well if we just talked about coping with change and things that might go wrong when we're travelling away from our home city, and you know how with MPNs we need to be prepared. And I think, you know, looking back at this year, we've had fires in LA, we've had um, earthquakes in Turkey and Peru, and we've had those terrible floods in Europe, all of which disrupt travel. And for MPN patients, that can be quite an anxiety-provoking time. And also, you go into sometimes political issues that also mean that there's a lot of uncertainty about travel. And so I was going to ask you, Claire, how best can MPN patients prepare themselves for change?
Well, it's nice to see you again, Nona, and it's nice to be part of this really valuable vlogcast series. I think that I would always encourage all MPN patients to be, fully informed about their condition and fully informed about the treatment they're taking. So to always have that information to hand. So that's either a fully printed copy, for example, of either a summary of your health conditions or a latest letter from one of your healthcare visits. You may think that it's adequate to have it on your phone or your laptop or your iPad or whatever, but what if you lose it? What if you're in a situation such as we've seen where you don't have any power supply, for example? So I think a paper copy is always useful. And that should also include, for example, any recent blood tests, but also a summary of all your medication. And coming to medication, I think it's always useful. Coming up to Brexit, I remember that we made sure that all of our patients at Guy's and St Thomas's had a plentiful supply of medication, and then we had to do that again in the pandemic. And I think it's always important to know how much medication you've got. And if you are traveling or anticipating that you might need to travel, to always have plenty of extra medication. And what I always say to patients, if you're traveling, for example, with tablets, is to put your tablets in several different places. Don't put them all in your suitcase and then you'd have to worry if your suitcase went missing. Put some in your suitcase, put some in your hand baggage, and then expect, as my father got stuck in America years ago when the Icelandic volcano erupted, that you may need some extra tablets to take with you in case you get delayed or whatever. So pack them in separate places. The exception for that is interferon, which you should never put in a suitcase and put in the hold in case it freezes, or any other liquid medication. So knowing your disease, knowing about your medication, and knowing how much you have. If you're in a situation where you might ultimately run out of medication, what I would say is, for the most part, not to worry, remembering that MPNs are very chronic diseases, and any changes, for example, with blood counts, do tend to be very slow. You make a red cell, it lasts in your body for 140 days. A platelet lasts for 7 to 10 days, for example. So if you were running out of medication, probably the thing to do, if you can't get supplies of medication, would be to just slowly reduce the dose. The two types of medication that I would worry about you running out of, first would be an anticoagulant drug. Not necessarily a drug like aspirin or an antiplatelet drug, but an anticoagulant. And a good example would be warfarin, or a direct oral anticoagulant such as apixaban, rivaroxaban, edoxaban, etc., drugs that we've been increasingly using instead of warfarin. Those drugs, once you stop taking them, their effect wears off quite quickly. So do be prepared and try to make sure you've got plenty of them. And if you're in a situation where you're delayed, for example, by a couple of weeks and you've maybe only got 1 week of medication, you might want to think about, after medical advice, if you can get it, potentially just reducing the dose if you cannot get that medication locally. In some countries, drugs are called by different names, of course, so important to remember that. The second type of drug that you really want to be cautious about, if possible not running out of, is a JAK inhibitor. And principally for most patients, that would be ruxolitinib or Jakafi. If you suddenly stop that medication, you can get a rebound of symptoms and spleen size. So again, if possible, make sure you take plenty of it with you, spread the tablets out in your luggage in case you lose some. And if it looks like you're in a situation where you may be running out, try where possible to contact your local health team. Your home health team, they may well have contacts in the country where you are, or contact a local doctor with the information you have. If you're really in a situation where you may well be running out of a JAK inhibitor, such as ruxolitinib, momelotinib, fedratinib, pacritinib, etc., the other option to consider is to reduce the dose so that you can continue taking it for as long as possible. But that really needs to be thought about in terms of your individual condition. I just also want to remind colleagues that most MPN care is the same across the globe. Some tablets are not available in some countries and they may be called by different names, but for the most part, you will be able to find somebody who will help you, and for the most part, you will be able to get equivalent medication and equivalent care to running to international guidelines. And then finally, I'm sure, Nona, you probably have something to say about this, which is also about, this can be stressful, and stress, of course, can lead to worsening of symptoms such as fatigue and brain fog. So writing things down, trying to practice mindfulness, not be worried about the situation you're in. We don't have to do social distancing. MPN patients are not immune compromised. They don't need to worry about being in a crowd, for example. And as I said, MPN care is pretty much the same globally. But looking after yourself, practicing some mindfulness, even if it's just a few minutes, I do it on the train to work every day, can be helpful. So I hope those messages are helpful to colleagues.
I think they're incredibly helpful actually in this ever-changing world. But also I think this managing anxiety is really important too, because nine times out of 10 when we're in a situation, we are completely powerless over it. And the powerlessness is something that we just need to let go, because otherwise it becomes unmanageable. The mind starts talking, what if this, what if that, what if the other, with actually no immediate solution. That's the time to really actually surrender and just breathe and do the things that Claire's just said. And so long as you've got your paper copies and you have access to a telephone, you can contact people. And as you say, missing a day or two for most patients won't be catastrophic. And it's sometimes possible to just calm yourself down and just think it will be all right. It's blue sky thinking. You're in chaos at the moment, but chaos doesn't last forever. And that there's, at the end of the chaos, there's blue sky thinking. And I think that's really important, to sit there and say, this will be resolved. If I'm sitting in an airport all night or whatever because there's a delay, I will get home. Fretting and worrying about it and pacing around is only going to make it worse for yourself. But Claire, thank you. I think this has been incredibly useful. And really interesting about interferon. And I'm just going to ask a question. I think perhaps, do people need to alert the airline before? Because I don't know whether they can take needles through the security.
Well, that's a great question, and I was thinking I forgot that. So we would usually provide a little note to say this patient's travelling with medication, and of course it's useful to keep it in a cold pack where possible. According to the different type of interferon, it can be out at room temperature, depending on what room temperature actually is. Right now in the UK, it's pretty hot for us at over 30, so it would then the drug would need to be refrigerated. So taking a note with you can be important, but I was talking to a patient the other day who said, I always take your note with me, but I've never been asked for it. So very important. And but you know, again, your clinic letter would suffice for that. And also, you know, if you get into trouble contacting your local team. I've been contacted before by patients from the airport, not generally about interferon, but sometimes saying, just left all my tablets on the train on the way to the airport, and I'm going to somewhere for the weekend. So that's fine, you'll be fine. Don't do it again.
Wonderful saying, stay calm and carry on. It is
Yes.
difficult. It is difficult at times, and I don't underestimate the difficult situations people can find themselves in. But it is almost a mantra that's quite useful. Just stay calm.
Stay
Anyway,
in the now.
yeah.
Exactly.
Anyway, thank you, Claire, and I hope you've all found this useful. And I think both of us would say, well, happy travels and travel safely, and we will see you soon.
Thank you, Nona.
Bye.